discussed multiple times. In fact, we have ourselves discussed multiple times in the past.
Yes,
So the
we
common
have.
complications of the COVID is a respiratory problem, respiratory difficulty. It affects the lungs, so the person might find difficult to breathe. We call the medical term of acute respiratory distress syndrome. In short, this is a swelling of both the lungs. The person find very difficult to breathe on day 5 to day 7 after the COVID infections. They find very difficulty. Whatever oxygen they are taking is not sufficient to maintain the blood levels of oxygen saturations. So the commonest complications of COVID, whether patient has got comorbid conditions and people who don't have immunity, is pneumonia, severe pneumonia that causes swelling of the lung, that is called acute respiratory distress syndrome. And second problem what we face is most of the time with COVID infections is blood clots. The blood clots can happen to the most of the vital organs. It affects your blood vessels or the lung. That causes pulmonary embolism. The clot we call medical term is called embolism, small blood clot. That if the blood clot is present in the blood vessels or the lung, that is called pulmonary embolism. Again, that also causes breathing difficulty, some amount of chest pain, some amount of congestions in the lung. Similarly, any other blood vessels, for example, blood vessels to the heart can cause us mild heart pain. This one myocardial infarctions or heart attack can happen. Similarly, blood vessels in the brain got affected, that can cause a stroke. Similarly, vessels in the peripheral part of your body can cause us gangrene, black color skin discolorations can happen. So clot is the second mechanism bothering the people. And third thing, the sugar levels. We know in the COVID-2, wave 2, a lot of people got black fungus because the sugar levels per se can go with COVID infections. Not necessarily the people who are diabetic, their levels can go up. People who are in the borderline category or people not diagnosed diabetes, once COVID comes, the sugar levels goes up. Probably it has got receptors in the pancreas where insulin is secreted. So the sugars can go up. Other organs like kidney, it can affect the kidney failure, a lot of kidney failures, new onset. So far, there's no problem. Following COVID, we are seeing kidney diseases. Particularly, people got diabetes, people got hypertension. Already, the kidney functions are on the verge of failure status. Once COVID sits on the top, the kidneys start failing. So, this type of cases we encountered both in wave 1 as well as wave 2. And this is early phases of wave 3 we are sitting right now. So, these are all the complications. Don't think COVID can cause severe pneumonia. It can cause blood clot. It can cause sugar level can go up. It can affect your kidney functions almost head to toe. Even skin manifestations also. A lot of skin manifestations we have seen. As I said, head, even people got memory disturbances. These all long COVID symptoms can happen. Acute COVID, stroke can happen. A lot of headache, other symptoms in the brain. And similarly, almost all the organs. If you want to label any organs, we have seen all the organ manifestations during the COVID, particularly people who got comorbid. Why? Because already the system is on overworking for them. They're stretching with the help of whatever immune system they're working on it. Once the overburden of virus, the system collapses, the organs start failing. That's the problem we are facing now.